I think what's so awesome is that Plachette and many folks have been working on convening our black physicians. This is our third year we've been able to do it. We have over 200 physicians from Northern California that are here, and we all know that the African American community, when it comes to heart conditions and blood pressure and diabetes, our risk level is at the top.
Yeah.
And a lot of things can be corrected if we just have awareness and do prevention and get educated properly. And that's what this is really about, educating our community and empowering us so we can go back to those that we represent and interact with on a regular basis on some simple steps that we can do to be healthy and live long, successful lives.
Now, what would you say is your top priority for coming tonight?
Well, I think my top priority is because I am not a physician, but I work in the medical field with cancer patients, to be able to hear from doctors and other African American doctors that are working with cancer patients, what they have to offer in their offices. So as we tend to connect patients with doctors that are supportive in their treatment process, to find out who they are in the community and to just learn.
Good evening. I'm here with Darcel Lee, the Executive Director of the California Black Health Network. I understand that you've recently applied for a very important grant. Would you like to tell me more about that?
Certainly, we sure would. We're very excited about it. As you know, our wonderful president has implemented the Affordable Care Act, passed the law, and we actually call it the Affordable Care Law now because it is the law of the land. And so in California, we're going to be the very first state to actually set up the marketplace for implementing it and making sure people have health care coverage.
Wonderful.
And so we applied for a grant from Covered California, which is the marketplace where people will get their insurance. And it's $1 million grant, and we're very excited that we have 14 organizations that are a part of this. Yes, $1 million.
Wonderful.
And SAC Cultural Hub is a part of our collaboration.
Wow.
And I know we'll add so much to this outreach and education effort. So we're excited about that, and we are just hoping we get it.
Our theme for tonight, which is discussing treatment options and preventative measures for cancer and the comorbidity of mental health illness, which is very predominant in our African American community. Can you tell us a little bit more about that?
Well, we know that access to care is a big deal.
Right.
And we know if black people are on clinical trials, their outcomes are the same as whites. And that's not known. And if we participate in clinical trials, we're going to get better care. And we need to seek out best practices, best places to go for that care. In terms of prevention, primarily, we need to stop smoking, number one.
Right.
We know if we stop smoking by the age of 40, you don't lose any life. But if you continue to smoke, you lose years of life after that. We also know that we need to be screened for colon cancer by the age of 50. That's a completely preventable disease. We know that we need to be screened for prostate cancer. When I came from D.C., the rates of death for prostate cancer were 4 times higher than whites in the metropolitan D.C. area. So we need to screen for that as well.
Right.
Good evening. I'm here with Dr. Darren Lattimore. He's the Assistant Dean of Student and Resident Diversity here at the University of California, Davis Health System. Dr. Lattimore, what do you believe to be the heart and soul of healthcare today for the African American population?
A rapport between the patient and their physician. We really cannot expect improved outcomes in our patients unless we approach them in a culturally sensitive way and in a way that they feel respected and understood. And so it is very vital that in order really as a physician for me to connect to my patient to get an understanding of how they feel about their health care, what they feel to be important, and to make sure they're part of the discussion and whatever the treatment plan is.
Good evening. I'm here with Dr. David Cook. Dr. Cook, have you attended the Black Physicians Forum before?
This is my first time attending.
Okay. And why did you feel it was important to attend tonight? And what do you feel that we can do as a people to kind of leverage some of the healthcare disparities in our race?
Well, a big problem in healthcare today is healthcare disparities, and that's the inequity in healthcare provided to many underrepresented minorities and underserved communities, specifically African Americans. African Americans are disproportionately and statistically shown not to achieve some of the same state-of-the-art care, specifically in my specialty, thoracic oncology, as other representative groups.
Now, can you tell us a little bit more about your foundation, Carrie's Touch?
Yes, Carrie's Touch is an African American breast cancer organization. However, cancer does not discriminate, and neither do we. So I always throw that disclaimer out there. But we are about raising awareness and education, doing a little bit of research, and providing support for survivors.
Okay. Now, you mentioned survivors. Now, are you a survivor yourself?
Oh, you know I'm a survivor. Absolutely. By the grace of God, I am an 8.5-year breast cancer survivor.
Wow, that is awesome. Now, what do you feel is the key role of African American physicians as it pertains to African American patients in today's society?
I think, when somebody looks like you, can tell you something that could help you, that our ability to relate goes to a whole different level. And that's what these physicians here, they feel a sense of community and responsibility to give back to folks who look like they look, and that's important for me as an African American mayor. So I think when they do clinics in a community, you can get more people to come out. First of all, it's a kind of a badge of honor when we see a doctor who's an African American who's climbed up that ladder and has been successful, but when they can then share some very simple advice or tips on what we can do to stay healthy, it means a lot to our community, and we listen and we respond. Now, we need to do more of it. We need to be proactive, and our outreach needs to be much stronger. But this annual gathering year after year has built good momentum, and we're going to continue to build on it. And I just love to see our life expectancy go up and some of the other challenges go down.
Right.